like we were saying earlier, that the term consultant is by nature to some degree nebulous. You know, if you're a consultant for whatever field you are, you kind of have to make your own association. So I think that that gives an opportunity for a behavioral health consultant who's working in primary care behavioral health, that if they do the competencies that are associated with that role, you define that that's what a BHC is. That's what a behavioral health consultant is in this system. And now, Jeff, what would you say, because one of the concerns that is often raised with novice behavioral health consultants is this idea that if the PCP is the primary consumer, that somehow insinuates or implies that that they don't really make a connection with the patient, that they don't really care about the patient, that it's, well, since it's all about the PCP being the #1 consumer, therefore then it must mean that they don't have that strong relationship with the patient. What would be your response to that?
And Jeff and Patti, before you answer that, I'm so glad that you asked that question, because I couldn't agree more with, I think there's a lot of misunderstanding where when we say, hey, the primary consumer is the team or the PCP, that is taking away almost from the relationship that you have with the patient. So I think that's a great question. Jeff, Patti, what are your thoughts?
Well, yeah, I mean, it's, you know, I agree that people have that misimpression for some reason, you know, quite frequently when you say that the, you know, the PCP is the primary consumer. And, you know, again, I think that, you know, just saying the PCP is your primary consumer or the team's your primary consumer, it doesn't mean then, it's not like you have a license then to do shoddy work. That's not what that means. It just means that, you know, you're trying to help a patient by helping the PCP to help them, and you're trying to help the team to, you know, take care of the whole patient population. I mean, as a part of that team, right? But yeah, it shouldn't really mean anything. It shouldn't imply anything about the quality of your work at all.
And so you feel that if you're going to be working with a patient, you're in the clinic working as a BHC, the PCP is like, hey, Jeff, kind of want you to give some extra, you know, perspective. We have a guy here who's really dealing with depression and, you know, seems kind of stuck. And you go in, you work with the patient, you come up with a plan, patient's on board with it, and you tell the PCP the plan, and things kind of get kicked off that way, and the patient gets better. From your perspective, the PCP being the primary consumer has nothing to do with not having a strong connection with that patient.
For you to be effective, you probably need to have a strong relationship with that patient yourself. So yeah, I mean, it doesn't, in my mind, imply anything about the nature of your relationship with the patient as the BHC. It's just about the structure of your visit with that patient, you know, like I said earlier, about how you're planning your follow-up with the patient. But it doesn't imply that, you know, that your therapeutic relationship with the patient is irrelevant or something.
Yeah, or like sterile, or some type of sterile nature. Patti, any thoughts on that?
Yeah, I think, you know, the way I've experienced it as a BHC is that it just communicates a lot of respect for the patient, their life, their needs, being available at the moment they want help. That's what they care about. You know, it's the door being open and you being there to help when they need help. That's a lot of intense work happens because of the immediacy of our access, and actually, you know, it requires a lot of training and ongoing training to stay on top of research and behavioral science and work as generalist and, you know, be there with the latest for the patients and for the team at that time that they say, hey, I'm ready now, I'm interested now, and not expecting more.
I think there's so much synergy that can go on where if, say that Dr. Smith utilizes Jeff for that gentleman dealing with depression, and then he learns something about how to interact with folks who maybe are in a similar situation. It's so rewarding when I've had my PCPs come out of the room and be like, I BHC'd them, I did this, and I knew to ask this question, and then they agreed to do this small thing, but they felt like it was a really important thing, even if it was small, quote unquote, and then it gets them going in the right direction. And I'd say the synergy comes in where there's been a couple folks that I've been working with where maybe they meet with me, then they follow up with PCP, and then they somehow get back on my schedule, they needed something, and then the PCP sees them, and then you guys are kind of debriefing about, okay, what's going on with Jane Doe, and the last it leaves off at is the doctor's like, oh yeah, I had a great visit with Jane. She knows exactly what she wants to be doing. She's on the right path. So she'll just call you if she needs something, or she'll call me if I need something. I feel like at those moments, you just feel like it was all hands on deck. You're utilizing everybody's skill set to the max, and it's all for the purpose of supporting this patient. And so, it doesn't feel like somehow just because I'm prioritizing to make sure you're available for the PCP, that somehow that's taking away from patients. I actually feel that it's really important to supplementing the patients as you guys described.